You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
There are many cases which I don't end up manipulating the patient at all. I needle them, it resolves the problem, and I have no need to manipulate the patient.
I understand there's more than one kind of dry needling. What are the different kinds and why is there more than one kind?
Yes, that is confusing to the public. Initially, when early dry needling, there were several papers written. One was treating animal tissue, rabbit, skeletal muscle, and the other was a small group of human study. And they found in what they were doing that if they took the needle and they basically jabbed the tissue multiple times, that it caused a response and the tissue would let go, would calm down. The question is it necessary to jab and stab the tissue to get that response? It seems nobody ever really tested that part of the theory. Now, the problem with that, as it is taught by many, is that it is very distressing to the patient. And what if the patient can't handle the therapy, then they're not going to be compliant with the treatment plan. So it was my experience that was counterproductive, because what that does, well, let me say, when the patient comes to any doctor, they're mostly in pain. That tells us that their nervous system is in a heightened state. And anything that's going to contribute to the heightened state of their pain is not very good. What we want to do is calm the system, calm the system. The technique that I evolved and that I teach does exactly that. It's very comfortable. The patients often will fall asleep, even in training, in a busy training session. As they're doing it, these doctors will fall asleep. This approach to needling causes the system, the nervous system, to really calm down quite a bit. So why some things in medicine get it's like a trend, or it gets picked up and they market it, and then they push it as the only way. And sometimes people who aren't as big as them are not heard as loud, but have a equally effective and more comfortable way of getting the same job done. So that is what I have evolved over time.
I understand. So, I mean, are there typical groups of muscles or muscles that dry needling practitioners work with the most, or does it vary?
The wonderful thing about dry needling in general is that you can apply it anywhere in the body from your head to your toes. Now, practitioners vary in what they specialize or what their focus is, So if you're a sports medicine working only with runners, then you're probably going to see more lower body problems. But if you're a practitioner who loves to treat women and pregnant women, then you're going to see a totally different set of problems. So dry needling can be utilized in any of these things. Or if you have let's say you're having a joint replacement, dry needling is excellent for hip and joint replacement, hip and knee joint replacements. So it just depends. Now, in my work, I see a lot of low back pelvic issues, because they're not separate. Low back is not separate from pelvis, and neck is not separate from shoulder and upper back. So these are contiguous areas that have to be treated as a unit. And that's often a problem because they're looked at separately.
I kind of can relate to that from my Feldenkrais teaching sort of knowledge. It's really quite simple to think, which is a fact, that we are just one skeleton. Being one skeleton, it's all connected. I mean, so to say, oh no, it's the neck, what are you doing in the back? No, it's a skeleton. It's one skeleton. So that makes sense to me.
But more than just one skeleton, we're an integrated soft tissue system. The real communication is in the soft tissue system. If you would, the skeleton is kind of dumb because it's managed by the soft tissue system. It does what the soft tissue system ultimately tells it. So if you can't turn your neck, it's not because your bone isn't allowing. The muscular system, the soft tissue system, is clamping down and is not allowing. If you release, the soft tissue system the skeleton will move much more freely.
No, but I find it as a way to visualize, because people just tend to compartmentalize and say,
Yes.
no, it's the shoulder.
Right.
When I think about it as a skeleton, yes, of course, it's all the stuff that is on top of the skeleton, like, you know, the soft tissue, just like
Right.
you said. But just remembering that one simple fact can already help, you know, that we are just one piece, you know.
Let me tell you one other thing that people don't realize, that the history of their bodies, their life history, your body remembers, your muscular system remembers. And there are things that happen earlier in your life that will come back and haunt you. And you will never make that connection unless you're really made aware of it. And I see this routinely. People who have old injuries, they all of a sudden have a problem. They don't understand why they have a problem. Many times there are connections back to a historical event. I think that's another thing that people should think about more.
You think that, I would think so, but I want to see what you think, that you know, emotional trauma, you know, PTSD and stuff of that nature manifests in a certain seizing of the tissue.
Totally. Yeah. Actually, the prefrontal cortex, which is where PTSD happens a lot, it knocks out your body. And there are actually very direct linkages between the prefrontal cortex of your brain and your muscular system. So in a way, if someone has PTSD, that is why body work helps people who have emotional events in their life. Now, that could be yoga, that could be Feldenkrais, that could be, you know, any number of things, but physicality helps to heal.
So now you come from a chiropractic background. It's your basic training is in chiropractic. What's the difference between a chiropractic manipulation and dry needling?
Completely different. Chiropractic manipulation is focused on the joint system. And the philosophy of the early pioneers of chiropractors was that if you manipulate, or the term we use is adjust, any joint, everything downline will be affected. And when every profession is educated in a biased way. You know, if you're an MD, you think drugs and surgery are the solution. If you're a chiropractor, you think manipulation is the solution. And the reality is that we have to put things in perspective. And that in my experience of observation, that trying to manipulate a little bony joint to try to move 30 or 40% of my body mass is just foolish. So you could get now, are they mutually exclusive? No, they're very complementary. So that if you're going to want to manipulate someone's joints anywhere in their body, you want to first manage and release the soft tissue system, because then that will allow the joint to move more freely, will give the patient a more comfortable manipulation experience. The manipulation will go much better and much easier and will last longer. Now, very traditional chiropractors don't like to hear me say that. It is against their fundamental belief system. But I believe that we're in science. We're not in a belief system. So I think when evidence is presented to us in science, we need to consider the evidence and then square that with whatever belief system we have been imbued with in our education. That's the challenge out there, is how can we change that paradigm of accepting evidence of something that is different and then changing our approach.
Well, of course, I'm not an expert in that field, but just logically, what you say makes a lot of sense, because if you are a chiropractor and you go in for a manipulation and all the soft tissue is seized up and things are extremely tight, there's going to be a big, whatever, you are cracking or trauma, or you're going to have to fight the pressure. But if you let that pressure go,
Correct.
It becomes softer and easier to manage.
But here's the other truth, that not everything is happening at the spinal level anyway. Because as I said, the nerves, once they leave, you have much more volume of nerve after the spine than you do in the spine itself. So there's many opportunities for the nerves to become impacted out after they leave. So for example, there are many cases which I don't end up manipulating the patient at all. I needle them, it resolves the problem, and I have no need to manipulate the patient, which goes against my fundamental training. But that's the reality of what I see.
Okay, so that kind of leads us to the next question, which is obvious. Obviously, we have this show to make it available to people if somebody is listening to this and saying, oh, where can I get this? So who performs this procedure and where is it available?
Yes. So let me just say that this is an area that's a little bit of a hot potato politically, because many acupuncturists don't like that we do it. So there's been a lot of infighting, turf fighting between them and mostly the PTs, the physical therapists, and the chiropractors. So it really is a state by state issue, okay? Because unlike medicine, which is nationalized, all the other professions have state rules about what they can and cannot do. So it depends where you live. So for example, where you are in California, the acupuncturists are extremely strong. In fact, along the West Coast, Oregon, I trained the first group of chiropractors in Oregon, and then the acupuncturists filed suit and got an injunction against them, or in Washington State. So the West Coast is a little tough. As we move to the middle of the country, really the middle, the East Coast is also a little tough, again, because of politics, like New York, where you should be able to, or Pennsylvania, where you should be able to, there should be no problem, but there's politics. So what patients need to do is to really say, look up dry needling in their area to see if it's being done and who's doing it. Most of the people who are doing it are either physical therapists and chiropractors. Again, in some states, more chiros are doing it because the PTs aren't, but PTs more and more are doing it in most of the states. There's less restriction on them because they've been more aggressive in the politics and dealing with it. Now there are a smattering of other types of people. For example, in some states, athletic trainers can do it, interestingly enough. Okay. I know, for example, in Connecticut, because I've trained some in Connecticut. So it varies by state, which is a little frustrating and confusing for an individual. I also have people who contact me from all over the country and saying, can you refer me to someone in my area? And if I have trained someone, I've trained over 1,000 people. So if I have someone in their state, I will refer them, but that doesn't always happen.
But from what I hear from you, in the states in which I reside, for example, the state of California, I cannot get this work.
No.
Okay. So,
and who suffers for that politics? You do.
Where would be a place, a resource where somebody who may live in one of the 50 states can look it up? And what would be an easy way to find the resources?
I really think using Mr. and Mrs. Google is going to be the quickest and easiest, because otherwise you have to go to national, like the American Physical Therapy Association. I don't even know if the American Chiropractic Association lists anything. I would say Google in your, dry needling in my whatever it is, whatever state you're in, to see who might be doing it. I don't know of any centralized resource that really knows what's going on around the country.
Okay, so in the place where you, by the way, what state are you?
I live in Maryland.
Maryland, okay. So does insurance cover this service?
Again, becomes a state issue and becomes a plan issue. So for example, recently, in the last few years, the American Chiropractic Association and the American Physical Therapy Association got together to create a specific code to describe it. Once they did that, the insurance companies, not across the board, said, oh, that's experimental and investigational, so we don't want to pay for that. However, there are many workers' compensation boards in the states that say it's equivalent to trigger injection. Also under, if you're injured in a car accident, it will often be covered. So again, it's not consistent, and it's not consistent with this within states, and even within some plans, let's say Blue Cross Blue Shield, some plans may cover and some plans and some may not. So it's a frustration of the healthcare system in general that we're dealing with here as to whether it is. But I have found it, many practitioners make it quite affordable for people who want to come, who want it, and people I find will pay out of their own pocket for this kind of service. People pay for quote unquote alternative medicine quite a bit, and there's no insurance coverage for it. But this is very, very effective.
Very interesting. So, I mean, again, this is the whole point. We have the show to open doors to modalities, therapies, knowledge that is not necessarily in the mainstream, but could be useful. So this really, I mean, this is a great, example of that. David, you've been doing it for over 30 years. Is there any publication that you have that if somebody wants to read further, or again, it's looking, online?
So I am not a researcher. Because I'm a frontline practitioner, so I don't publish in major journals. I've written some articles for the American Chiropractic Association. I wrote my training manual for professionals. My website has some information, and in fact, I just want to say I loved the questions that you sent me so that we can present it to the public in a way. And I'm going to take that information and I'm going to put it together. I'm going to put it on my website, so that people can then can learn more about it. Sometimes when we're as health professionals, we're not thinking about how to break it down for the public in a way that they can consume it, understand it, and then take action on it.
So since we're on that subject, what is your website, David?
So my practice website is fishkincenter.com. My teaching site is dryneedlinginstitute.com. But I'm going to post this information on both. So whatever site they go to, I'm going to have that information there for them. And then they're always welcome to email me. I'm always getting emails and I respond. I respond very quickly, actually.
What would be a good email for you, David?
dryneedlinginstitute@gmail.com.
Okay, it's easy enough. Finally, do you have any final words of wisdom to the people viewing this, some of whom may live in New York or California, some may live in Maryland? I mean, just in general, some may live across, the ocean. Do you have any words that you want to give them?
I want people to understand that there are options. Because we have a huge problem in this country for sure with chemical dependence. And again, drugs have their place. I am not against the use of medicine. I encourage people to take medicine, or I encourage people to have surgery when it's appropriate. It's always about what's appropriate. And, if you have a structural musculoskeletal problem, right, that's trying to change a tire on a car by changing the oil. If you change the oil, it's not going to affect the tire. So drugs can be helpful in the short term, especially, but oftentimes they really don't reach the problem. And patients will say that all the time. These drugs are just not reaching the problem. But for a structural problem, you need a structural or manual approach to get the kind of response that will help people decrease their dependence on these medications, to get off of them and to get them independent. My goal is for patients to be independent and living their life, not to be dependent either on me or on medicine. But there is a process. And when a patient has a chronic problem, there are people who are legitimately have chronic pain. They need that medicine, and they're not addicted in the way that others are addicted. And people who have conditions need support. And this is the type of support that I give to the musculoskeletal type of situation. So I want people to keep their minds open as to what's out there, and don't be so fearful of things that are not in their typical bailiwick.
Yeah, but that's why I think we do this show, exactly. So, I mean, by the way, how long do the effects of dry needling last when you do a session?
So, again, it varies, but in some cases, a few sessions and they're done, completely resolved. Some take longer and some don't respond. Why don't some people respond? We don't always know why. But I will also tell you that when patients aren't responding, that moves me to then do further diagnostics. And this tool of dry needling has helped me to uncover underlying disease such as cancer. And when patients have been seeing other doctors and thinking they have back pain and back pain and back pain, and even an X-ray doesn't always show the cancer, when I don't get a response, I want to know why. So I will ask for blood work, I will ask for imaging to make sure there's no underlying disease. Now, if there's no other underlying disease, there are cases we just can't resolve. We don't always know why. That is the big challenge. Why is it some patients respond beautifully and some don't. And that is there are many research questions to be asked. And if I live long enough to do a PhD, maybe I'll start to answer them.
Well, David, thank you very much for taking the time to be on our show. Today, I want to thank you a lot. And I'm sure our viewers are going to be fascinated. This is something new for a lot of people. I want to once again say thanks.
I just want to thank you for what you do as well.
All right.
I think you're doing a great thing for people.
Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.